Hi, my name is Dr. Wade Brackenberry, and I want to talk a little bit about the ACC thoracic block. And there's many types of thoracic blocks on the market. This one I personally designed myself on the computer in CAD, and later we had it made here in Vietnam. And this thoracic block is used to relieve muscle tension and pain in the thoracic spine. It's also used to help reform the spine when the spine has improper curves. Okay? And the most common improper curve is what we call the thoracic hyperkyphosis. So this is mostly people who tend to do this. So a lot of people, because they use devices, they use phones, things like that, they tend to go forward like this and have a hyperkyphosis. And that leads to pain, and also it doesn't look good. And so this was designed specifically to correct the hyperkyphosis, but also just for people to relieve tension and pain in the spine. And we have other uses for it as well. Right? How the thoracic block is used in a hyperkyphotic patient. So the thoracic block is used for self-treatment. And I'm going to demonstrate now how to use it. Okay? So first, I'm going to put it on a hard, flat surface like a yoga mat. And I'm going to turn around and sit down. And then I'm going to link the block up with the part of my spine which is the most curved. And then I'm going to lift up my lower body so that this is parallel. And then I'm going to reach above my head like this and blow out. And then I can gradually also lay back my head like this. In the beginning, we would do this for only a few seconds. But as the patient becomes more and more used to it, they can do it for a longer period of time, even working up to 2 minutes. And there's an alternative way to use it, and that is that we come up like this, and we just simply sit like this, and then arch the back up over the block. So we can put the hands like this, and just arch back, and keep the spine against the box. We start here, arch back. And then, so people have muscle tension all down the spine. They can start here, go, and they can also reach behind like this. Properly done, the thoracic block in a person who has hyperkyphosis and gradually to reduce the kyphosis and to have the spine be more straight. Moments. Let the body normalize. And if instructed by your doctor, you may have other exercise to do. For example, many times after doing that, I would ask my patients to lie on their tummy and to do a press up like this, which accomplishes the same thing but in other parts of the spine. After doing the thoracic block, I would rest for a few moments and make sure that I'm not dizzy. If there's dizziness, then we would want to lie back down and rest a little bit before we get back up again.